My name's John Howard. I'm the Postgraduate GP Dean for Health Education in England, working across the east of England. We've been really delighted to put on this programme. For too long, primary care has been lacking in resource in terms of support for leadership development. People have thought of primary care as being groups of small GP practices and have largely sought a GP to come and get involved with leadership and change. This programme's intended to change all that and to empower teams. We've been really grateful for the support of the Eastern Academic Health Science Network, of the Leadership Academy, and what we've aimed to do is invite trios of people encompassing all the talents of primary care. So not just GPs, but other clinicians, nurses principally. There are some dentists here, which we're really thrilled about, managers and administrative staff. And what we wanted to do was really to pull together all of those talents and empower them, to enable them to make change, to understand how change happens and to lead change in their localities. So for me, this has been a great experience. I've enjoyed meeting all of our participants. We've had some fantastic speakers. We've gone through the process of thinking about individual leadership. We've looked at leading change within the NHS. We've looked at innovations, and we've looked at why change doesn't happen. And alongside all of that, of course, our fantastic participants have really put energy into the projects that they've been working on. We've seen some terrific change occurring as a result of that, and it's just been great to see their commitment. So I'm very grateful to have been part of this. I think it's been a great experience. I hope that in future we can see a similar exercise working, because actually if we don't, we'll have missed out on the opportunity of harnessing that energy and commitment I've talked about.
I think the best thing about the primary care leadership collaboratives has been engaging with other professionals from the primary care arena and actually talking to them about some of the challenges about leadership within primary care that they face, and looking at those, associating those with the challenges that we face ourselves.
The quality of the speakers, really interesting, all different fields, really making you think about all different aspects of leadership, inspiring stories.
Leadership is something, say, from a dental perspective, it's not something that people necessarily concentrate upon. So it's given people an opportunity to develop themselves further, to integrate across professions as well, so that it's not something that we routinely experience, and it's been an entirely new experience, and one hopefully which we can then engender into the professions so that others can get involved in the future.
I'd like to see more collaborative working. I think I'd like to see the different disciplines and professions having a better understanding of what each other do. But as well as working within primary care, I'd like to see them as working better with our secondary care colleagues, our community providers, as well as the mental health sector, and of course social care. So I think I'd like to see a lot more collaborative working, which was demonstrated on this programme.
I think the thing that I'd most like to change is actually the collaboration between different elements of primary care. So there's a big focus obviously on GPs and the communication around GPs and practices. But I come from a dental practice background. Obviously there's optometry, pharmacy. Generally, historically, we don't talk to each other, and I think that's something that we really need to focus on and overcome for the future and the benefit of patients.
It's how we manage projects. I think in the past we've missed the point of actually documenting project specs and having a vision and sharing that with our peers and the other staff within the practices. It's easy to make an assumption that everyone's singing from the same hymn sheet, but in reality that doesn't happen. And the more you can communicate and the clearer you can communicate, the better it is.
Absolutely. It was a really great experience. I do believe there is scope for introducing other colleagues outside of primary care to join us in from a SCP perspective, so that we are playing on the same field.
Absolutely. I've certainly found many tools to use, particularly today, having that difficult conversation, using hot seats. There's been lots of really useful ideas that we've picked up on.
I definitely recommend primary care collaboratives to colleagues because of the opportunity it gives you for discussion about topics that might be congruent with where you come from, but also open up ideas about how to deal with different challenges that you face on a day-to-day basis. Having the opportunity to discuss it with a wider variety of colleagues from a wider variety of backgrounds can really open your eyes.